Good morning and thank you for joining us. My name is Tina Tebow and I will be your moderator for this morning's media briefing. Joining us today, the Honourable Randy Delorey, Minister of Health and Wellness. Minister Delorey will give brief remarks and will then be available for media questions. Go ahead, Minister.
Thank you, Tina. Good afternoon, everybody. Thank you for being here. This has been one of the most challenging times in our province's history. COVID-19 has altered our reality. This pandemic has caused pain and suffering for so many, especially for long-term care residents, staff, and their families. And this occurred in particularly at Northwood. I understand that families are still grieving the loss of loved ones. I understand that staff will continue to face challenges as they go to work. And I understand that residents and their family members want to spend more time together, but also continue to live with the worry of keeping everyone safe. We have 133 long-term care homes in our province. 9 licensed facilities had either a resident or staff member test positive with COVID-19. But it was Northwood that had the majority of cases and deaths. It was Northwood residents, staff, and families that felt the brunt of this virus in Nova Scotia. That's why I asked for a full review to determine what happened at Northwood. I want to thank Dr. Latta and Dr. Stevenson for their measured approach and careful examination of the outbreak at Northwood, and all of the stakeholders and individuals who participated and provided their input through this process. I also want to thank the health and wellness staff, the Nova Scotia Health Authority staff, and all of the partners who worked on the review of infection prevention and control measures within the broader long-term care sector. Together, you've given us insight into the issues at Northwood and across the long-term care sector. These reports are consistent in their findings. They acknowledge the measures that were put in place in advance of the pandemic and during the first wave, but they also point out to the challenges. And most importantly, they give us recommendations for improvements. Some of these recommendations include improving infection prevention and control within the existing architecture at Northwood, reviewing and updating pandemic plans, creating a mobile infection prevention and control team to support facilities facing outbreaks, addressing staffing challenges with more employees for housekeeping, resident care, screening and visits, and human resources plan for the sector, clarifying roles and responsibilities within the Department of Health and Wellness and the Nova Scotia Health Authority, restructuring the disaster response teams, and improving communication throughout. And we agree with the recommendations and the intentions from these reports. Some of the work to implement recommendations is already underway, and we're pursuing many others immediately to ensure our long-term care facilities are better prepared for a second wave of COVID-19. We're taking the following actions immediately, with the aim of having them in place before a second wave hits in Nova Scotia. We will establish a mobile infection prevention and control, or IPAC, drop team in each zone. This is a multidisciplinary team of experts that can be deployed to provide extra support to facilities that are facing outbreaks. We will ensure that each zone has an IPAC resource person dedicated to supporting long-term care facilities. We will ensure that each zone has additional occupational health and safety resources. And we will ensure long-term care staff can get tested and back to work as quickly as possible to help alleviate staffing challenges during an outbreak. We'll be providing funding for small capital projects and equipment purchases to support IPAC in long-term care facilities. Things like lock boxes and carts for medications, additional hand sanitizing stations, personal protective equipment or PPE carts, room dividers, and more. We'll provide funding to support additional cleaning, which could include hiring additional staff or purchasing additional supplies. Beyond the IPAC drop teams, we'll provide funding for other staff who can be deployed as needed to support in an outbreak. We'll provide funding so that facilities can provide the specific care required for residents who have COVID-19. We'll continue to work with facilities to ensure that they have no more than 2 residents per room, and the support we're providing for increased cleaning will also help with the IPAC needs in bedrooms and bathrooms. We provided personal protective equipment for COVID-19 to long-term care facilities and home care agencies during the first wave, and we will continue to do so. Also, during the first wave, we developed a toolkit that was shared throughout the long-term care sector. Both reports noted that this was a very useful kit. This will help us work with facilities to develop more robust pandemic plans and prepare for staffing challenges before the second wave. A longer-term project that will get underway as quickly as possible is to build upon that toolkit to develop a robust IPAC program for the long-term care sector. It will include education and training, online learning platforms, resources, tools, and best practices, monitoring and reporting, and guidance for outbreaks and surveillance. We plan to invest about $26 million in the current fiscal year to support these recommendations, and $11 million over the next 2 years to advance actions to help prevent the spread of COVID-19 in our long-term care facilities. Thank you, and I'll take questions now.
Thanks, Minister. Again, just a reminder, we'll take media questions from the room first, and then we'll go to the phone lines. You will each get 1 question and 1 follow-up. We'll start with Keith Doucette from the Canadian Press. Go ahead, Keith.
I'm wondering how quickly we can get most of these recommendations by the 2 doctors in place. What's the intention of the department?
So the intention is and some items were things that were implemented through the first wave. Just for example, the notion of centralized personal protective equipment, or PPE, distribution. That's something that we implemented through the first wave, and the recommendation is to continue that. So that's in effect. Other items in terms of staffing up and building the drop teams and having dedicated infection prevention and control practitioners, specialists available throughout the sector will of course require the time to do the hiring, but we have the resources, the financial resources ready to begin that process immediately.
Go ahead with your follow-up, Keith.
I'm still wondering though, on the 17 recommendations, what do you think of the timeline is for the province to get them all in place?
Oh, for all of them? Oh, at this point I don't have a final deadline. Some of the items, particularly the longer term items, which gets into the area of legislative modernization and changes, that's going to take some time to analyze and get assessed as to what specifically needs to be addressed within there and how to best go about doing that. So those, I guess, larger, that require a lot more research. Once we have that assessment done, we'll have a better idea of timing for implementation of those pieces. However, I think when you look at the breakdown of the more short or immediate term items that are in the recommendations, many of those build up into the longer term. So there are things that we can do to help improve communication and workflow without the legislative change. The legislative change just really locks in what those best models would be. So I think we'll get to a good place with the immediate actions, but there's work, so I don't have a deadline for everything.
Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
Minister, I'm wondering about Northwood's proposal to move to single rooms that has been on the table for a while. Where does that stand? And with the benefit of hindsight, what is the government's position on not having moved on that sooner?
So I think that gets into a number of factors. First and foremost, the review that was conducted at Northwood has not indicated that a move to full single rooms was, in and of itself something that would have prevented the infection outcome. We've seen people in single rooms get infections. So what we have as a province is since about 2007, our standards in place are for building and renovating constructions, including the over 100 new beds that we're building within the province that are building to single room standards. We currently have, I think, over 55% of our rooms in the province are single rooms. So that's something we've been working on as a province and will continue to do so. What they have highlighted was, of course, a need to improve infection prevention controls, variables that can be managed within the environment that is there today. And so that's where a number of the specific recommendations will improve. The other piece is that we're certainly committed. We know that we have just over 30 rooms across our continuing care sector that have more than 2 beds in those rooms, and we'll be working to bring our entire sector to no more than 2 rooms per bedroom, 2 beds per bedroom.
Go ahead with your follow-up.
So, Minister, just to make sure I understood you, you said there are 30 rooms that have more than 2, and so how many homes, how many residents, and how soon does that affect, and how soon do you think that can be done? So
that's something we're going to be moving on immediately, and that's, again, those 30 rooms are across the entire sector, across the entire province. So keep in mind we have over 7,000 beds, so it is a small portion of the total, but it is a step that we will be taking, and the action will be starting to work with those facilities to manage the occupancy and the licenses accordingly. So that work will be beginning right away.
Next, we'll go to Alicia Drouse from Global. Go ahead, Alicia.
In addition to the sharing of rooms, we've heard actually that one of the more problematic things was sharing a bathroom. So you've made the commitment to not have any more than 2 people per room, but what about a commitment to the reduced sharing of bathrooms? Is there anything for that?
So that's one of the things that Drs. Latta and Stevenson noted through their work in the Northwood Review, the recognition that within facilities, the built environment, there are some limits. So you have recommendations that have us take steps to reduce the risk of cross-contamination within those shared washroom environments, and so that is work that we will be pursuing.
So you're not reducing the number of people who share a bathroom?
Well, again, you require a certain number of washroom facilities. What the recommendations are focused on is how we reduce the risk of cross-contamination within there, and how the built environment can support an infection prevention control steps, and that includes some of the investments that we have targeted towards capital. But again, it would depend on each facility as to what capacity or opportunities may exist around the actual built environment.
Next, we'll go to Bruce Frisco from CTV. Go ahead, Bruce.
Cleaning has come up a few times. You've mentioned it, and it's in the reports here. What's your message for families who've expressed concerns that cleaning was an issue at Northwood, and now we know it was? Yeah,
within the entire sphere of our COVID response, you're right, the reviewers acknowledged that as we operationalized enhanced infection control measures, which meant enhanced cleaning, coupled with reduction in staff availability at the site, that other certain tasks that would have been the routine cleaning operational work was lower down on the priority list. But what I think is important is that the staff that were operating and pursuing those tasks that were seen as most important and critical to preventing the infection and spread within the facility, and that efforts were made to replace staffing to ensure that they had the support they needed on site. What the report does make recommendations, though, is important to have that aspect of staffing and not just our direct personal care staffing as part of our pandemic planning and response, recognizing that the cleaning staff, household staff are a critical part of the support operationally, including in an outbreak time.
Planning to hire more cleaners?
Yeah, that's one of the investments that we've committed to is to support, and that could be hiring additional staff as facilities need, or additional supplies, and then some capital investments as well.
Next we'll go to Brian Flynn from All Nova Scotia.
Minister, I'm wondering why it is that the government's moving, getting rid of the multiple residency rooms above 2, but allowing 2 beds to continue. I'm wondering, is that based upon any evidence that is safe for residents, or is that based upon the realities of the cost of getting rid of them?
Well, as I said, first, the ability to operationalize in the immediate term, very short term, occupancy above 2 is something that we can work as part of our capacity planning to operationalize quickly. We already have policy in place and commitments around our built environment to support transition with new builds and major renovations or replacements that do move to a single room as the kind of the default standard. But I think the other thing that's important to note is the ability to move in this area is individuals do report like having a roommate and so forth. So in not all instances is it unanimous desire to have a single room environment. And then from the clinical and the review on the reports that we have was, that wasn't flagged as a one of the more critical elements and need to pursue. So we focused on continuing the path we're on for builds and rebuilds. We already have, as I said, over 55% of our rooms are single rooms across the long-term care sector, and with the new builds that come on stream, they'll be building to a single standard as well.
Go ahead, Brian, with your follow-up.
Specific to Northwood, there's a recommendation to reduce the density in the population. I'm wondering by how much will you reduce the density and population in Northwood?
So we have been operating at Northwood, which occurred as part of our response to the outbreak that was there at a reduced capacity. I believe early on we worked to establish about 30 beds in a COVID ward to support, again, anticipating a best practice for how to respond to an outbreak. The unfortunate reality is the outbreak at that location far exceeded the capacity of what was prepared for a COVID ward to support. So believe we have something in the vicinity of about 90 beds being held now at that site, and they've been managing well in that regard. What the longer term permanent changes may be there, I think we have to have more conversations. A specific number I don't believe was provided in the recommendations. So we know that 30 wasn't enough for a major outbreak at a facility of that size and complexity. But what the final number should be, we'll have to dig a little deeper.
Next, we'll go to Chris Hallett from News 95.7.
Yeah, earlier I had asked about Northwood's communication with stakeholders, and it was described as largely inconsistent. I'm just wondering what your thoughts are on that, and what your department will do to ensure that that is addressed going forward.
Yeah, that's something, again, during the outbreak, we became aware of in kind of real time that, we would hear from people concerned with the communications, and there's a lot of uncertainty and concern there. Much of our focus at the time was certainly communications within the sector and responding to the operational needs, the needs within the facility. And I think that's exactly what a review like this is so important for, is to flag and identify and bring the recommendations that it's not just the clinical response that's important, but also the response to the people that are also affected, which would be the family members and the loved ones. So the recommendation that comes from the report is for us to the degree possible, in advance of an emergency situation, have it defined what kind of frequency communication to family members, loved ones will be, and what types of information will be included. And of course, there are times there's certain information that cannot be included for various other legislative reasons, privacy or what have you. So they need to be very clear as what can be shared, what cannot be shared in advance. So that in the height of the moment of an outbreak, people aren't feeling like someone's not communicating with them.
Go ahead with your follow-up, Chris.
Yeah, leading up to this, the province faced some criticism over opting for a review rather than a public inquiry into the matter, and there are still those who, even after these recommendations have been released, will still want a more transparent process into the matter. I'm just wondering what your message is to those critics.
Well, I think when I announced this review, being led by Drs. Latta and Dr. Stevenson, really following the quality improvement process was the most expedient way to get a review of circumstances that took place and tangible recommendations that we could implement to prevent future outbreaks like this at Northwood, or minimize the risk of a major outbreak. So this is why we chose the path that we did. I believe the recommendations and the work that was done was well done, and I think it does provide us with a good path forward to, again, with immediate initiatives that we can be and will be investing in moving forward, as well as some longer-term changes that are a bit more structural and long-term.
Next, we'll go to Olivier Lefebvre from Radio-Canada.
Merci. About the communications with the families, again, do you consider as a province giving the same guidelines on communication plans for all long-term care homes in the province?
Yes, so with this Northwood report, while the review and the assessment was specific to that location and the circumstances, because that was by far and away the largest outbreak we had, the reviewers were focused there. But as a department, as a government in the province, we are taking those recommendations and internalizing them, and recognize they actually can support improvements across the entire sector. So although it's a Northwood review, I believe the recommendations transcend that one facility. And you've asked specifically about communications, and that would be the same thing. I think when we work with our partners in the long-term care sector, because had there been an outbreak at another facility, if they don't have that type of predefined communication protocol that the reviewers recommend, I think they would have found themselves in a similar, potentially in a similar situation as Northwood, with concerns from family members about whether it was consistent or inconsistent communication. So I think the recommendation does apply across, and I think that's the case with many of them.
Go ahead, Olivier, with your follow-up.
Yeah, there's always, from what we understand, going to be risk, even with the best preparation. So I'm just wondering, as the health minister, when will you feel comfortable that the long-term care homes will be in the best position for second wave readiness?
You know, that's a challenging question, as simple as the words make it appear. But the reality is, and I think anyone who works in an area like infection prevention control, occupational health and safety, that is a risk-based discipline, would tell you that you're right, as you said off the top of your question, you don't reach zero risk, but you continue to pursue continuous improvement so that you continue to improve the situation over what it was there previously. When you have the opportunities to see lessons learned, you conduct reports and reviews to chart a path forward. So, you know, taking the actions that we're taking, I believe, will reduce the risk based upon the advice that we've been given. What we know is some of the retrospective awareness that this report showed us is some of the actions that were taken based upon previous reviews and what we thought were best practices, they've identified as having some unintended consequences. And I'll just use for one the notion of having family and visitors within the facility and the trade-off between reducing the risk of infection within the facility and offsetting kind of the quality of life for residents and their loved ones. That, you know, by closing down fully, it had consequences, you know, very good for risk mitigation of infection control, but other challenges that were presented as a result. And so that's why we continue to look for those opportunities to strike the right balance, minimizing the risk of infection while also respecting the needs of the people living in those facilities and their loved ones.
We'll now go to the phone lines. Again, if you're not asking a question, please ensure that your phone is on mute. We'll start with John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Minister, can you talk more about the mobile infection teams? Who will be staffing these teams? How will they be hired? How many people are we talking about in terms of the team numbers? Can you talk a little bit more about that?
So this will be work that is going to take place at the zone level. So I guess if I break it out so it makes sense. Within our long-term care facilities, we have an IPAC designate, someone who's one of their tasks is to be responsible for infection prevention and control within each location. What came out of this review and the recommendations, we need to strengthen the support for them, particularly during a time of outbreak, but also to support them with education and training and best practices. And that type of staying at that level of detail, really you see IPAC practitioners, really highly skilled professionals in this area. So we'll be building capacity within our zones to have IPAC practitioners who will support facilities throughout the zones. When there's an incident or an outbreak and a facility's IPAC designate thinks they need to reach out for help, they would go to this individual, this zone representative who has more training. While they work together, if they need even more support around infection prevention control, and whether it's on education, training, preparation, or response, they can tap into a team, and that's the IPAC drop team that we've referenced. That team then may be multidisciplinary and tap into occupational health and safety, infection prevention and control, clinical, as well as other on-the-ground expertise. But it would be built to respond to the specific situation. But they would be available to be tapped into and come together to support the needs of people. So that's the infection prevention control, kind of that stepped level of support that would be made available.
Go ahead, John, with your follow-up.
Thank you. Dr. Latta described Northwood as a small city with complexities that exacerbated the outbreak. Obviously, facilities of this size are problematic. Do you have any plans to eventually close Northwood?
So that's not a plan that's come up. Again, the recommendation has talked about maintaining a lower occupancy rate. We have been doing that throughout the first wave. Began managing with a COVID ward so they could respond. I believe it was about 30 beds that they were working to support an outbreak. That wasn't enough, so the panel does recommend keeping the occupancy lower, although I don't believe there's a specific count. I think we've been running at about 90 beds since the first wave reduction. So we'll dig in a little bit deeper to see what the long-term occupancy should be at that site and work with Northwood to determine what implications that would have for them as well.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Minister, your recommendations from the out-of-province experts talk about the need to set and fund standard minimum care hours based on resident complexity across all facilities. And it refers to the Nurses Union Broken Homes report, which has been out for, by my math, almost 6 years at this point. The IPAC report that you've put out today from your own staff talks about the problems that staff levels experience as a result of low wages, poor benefits, and not enough support for people who work in the long-term care industry. And yet your news release and your own comments don't touch on any of these things. What commitments are you and your government prepared to make at this point to improve working conditions for the people who staff long-term care sites?
So as it relates to the specific point around staffing rates and so forth, that was a commitment made in 2019 when the expert panel that I put in place that they conducted their work in the fall of 2018. But that recommendation, like the recommendation in the Northwood review, denotes the need to conduct research to determine what exactly that needs to be. So we have been working on the basis of that expert panel report with experts within the sector, in particular the Centre for Aging out of Mount St. Vincent University, to help dig into that specific area to chart our path forward.
Go ahead, Mike, with your follow-up.
Well, respectfully, Minister, that report came out more than a year ago, and we have very tangible and quite frankly, dire evidence of what happens when those things aren't acted upon. So how long is it going to take to finally settle on something that people from within the sector have been calling for the better part of 6 years?
As I'd indicated, we have taken action to answer the question that was flagged both in that report as well as the most recent recommendations. So what I would flag is as the recommendations out of the Northwood report highlight the need to identify
Jennifer Henderson from the Halifax Examiner. Go ahead, Jennifer.
Just following up, Minister, on Mike Gorman's question. My understanding is that work on identifying level of care, hours of care for residents with complex needs, that data is available from many other jurisdictions. Why doesn't the province commit to amending the legislation based on work that already exists in other provinces and states?
As we looked at this, at least in my tenure, with a particular focus with the expert panel report, We took their recommendations to work to answer these questions, and we recognize the valuable work within our own province, and so we've been working to answer those questions. Certainly, anytime research and reviews are conducted, they often include jurisdictional scans to evaluate information that's available from other regions, and I'm sure that's part of the operational work that's taken place with the research.
Go ahead, Jennifer, with your follow-up.
Yeah, the purpose of both reviews were to improve that. I haven't heard anything in your comments or the release so far that indicates how 42% of people who share rooms and communal bathrooms will be better protected if we have another outbreak in a long-term care facility.
Well, thanks for the question. I think first is that, again, a reminder that throughout the first wave, with the 133 facilities that we have, and although we did have infections of either staff or residents at a number of facilities, we really had one with the devastating impact, and that is Northwood. They all carry a similar structure, those that would be built of the same vintage as Northwood, with a mix of single and double occupancy rooms and shared washroom facilities. So those same fundamental infrastructure components existed throughout our long-term care sector facilities. Through that size leads to increased complexities that smaller facilities wouldn't have necessarily had to manage through. And as it relates to the need to separate, that's where the notion, and we had this planned and operationalized through the first wave, was the ability to hold vacancies within facilities to act as COVID wards, or areas where they can isolate and support if an infection took place within a facility. What the reviewers noted about Northwood, even though they had about 30 beds allocated for this purpose, that in fact the size of the outbreak exceeded the capacity that was allocated for, and we have been managing with a higher degree of vacancies, that is beds that are available, to help support that at the Northwood site since that first wave. So really, I think perhaps it wasn't highlighted or stressed because it's something we've been throughout the healthcare system, within the department, within the health authorities, the long-term care sector. I want to thank them in particular for their efforts on this review, but also for the work that they do each and every day, and in particular the last 6 months. Those of us here in this room, or those of you in this room, may not realize really just how challenging throughout the acute as well as the long-term care sector, the response and the challenge for healthcare professionals and their administrative teams has been. So I thank them for the work they do each and every day, and in particular in supporting us to complete these reviews to help improve the to chart a path for us so we can improve the outcomes going forward. So I know that the review itself will in no way make up for what transpired at Northwood and the 53 lives lost. Not to the staff members for whom these residents were family, like family, and certainly not for those family members. It'll never take away the pain, and it won't bring back what was lost. So while we've learned a great deal through the first wave of COVID-19, and we've made improvements in real time in our long-term care, we know that there's more to be done. We know we have to do better, and we're committed to doing so. It's my hope that we will learn these valuable lessons that these reviews present for us so that we can make the necessary improvements at Northwood and throughout the long-term care sector. And we'll be able to do that because of the recommendations that have come forward in these two reports. We want to be in a stronger position to manage a second wave, and I believe that implementing these recommendations will do just that. We know we want to ensure that our most vulnerable are safe and protected at Northwood and throughout all of our long-term care homes in the province. They deserve nothing less. Thank you.